Hello, everyone, and welcome to today's webinar, Healthcare Recruitment, Optimizing Strategies with AI-Powered Tools. My name is Brian Zimmerman, and I'm pleased to serve as moderator today. On behalf of Becker's Healthcare, thank you so much for joining us. So before we get going, I'm just going to walk through a few quick housekeeping instruction. Today's webinar will consist of a panel discussion, but we do certainly welcome any comments or questions. You can submit those throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. If any time you have trouble with your audio or video, you can try refreshing your browser, and you can also submit any technical questions into the Q&A box. We've got folks on the back end who are available to help out with those issues. So with that, let's go ahead and meet the panel. I'm going to tap on each of these distinguished leaders here to share a bit about their professional background, some relevant details about their organization. Meredith, let's begin with you.
Great. Thank you so much, Brian. My name is Meredith Lapointe. I'm the Chief Business Officer at AMN Healthcare. We provide total talent solutions across healthcare and work with our clients to both provide talented individuals as well as technologies to support, workforce management, workforce operations, and really ensuring that the right people get where they need to be at any point in time. I've been at AMN for about a year. I oversee our strategy, marketing, and client accounts, and have for the last 2 decades been in healthcare, focused mostly on healthcare workforce. Previously worked at McKinsey & Company, where I was a partner leading our global healthcare workforce teams. So great to speak with all of you today.
Great to have you, Meredith. Thank you so much. Garrett, let's meet you.
Good morning. So Garrett Olin, Chief Information Officer with Shasta Community Health Center in Northern California. Been here for less than a year, but CIO in different industries for about 30. Been in healthcare for about 8, and looking forward to having this discussion.
Yeah, thank you for being here, Garrett, and bringing your perspective to the table here. Wendy, go ahead.
Hi, everyone. I'm Wendy Fournay. I am the Chief Administrative Officer here at Erlanger Health in Chattanooga, Tennessee. Prior to coming to Chattanooga, I've been in different roles, particularly Chief Human Resources Officer and Chief Administrative Officer as well. About 20 years of experience in healthcare, and looking forward to talking about AI.
Yeah, looking forward to getting into it, Wendy. Thank you so much. Rick, go ahead.
Hi, Rick Garbett. Thanks for having me. I'm Vice President of People Technology and Analytics at Children's Health, North Texas, relatively new, started last year. Came from California, so I'm a new Texas transplant like the thousands of others that are coming to Texas these days. It's a very exciting time to be here. Children's is obviously a leading provider of pediatric and children's healthcare in North Texas. We are going through expansive great expansion across our different campuses, and with that comes the use of more technology and better and more efficient ways of using that technology. So I've spent many years in this area, and looking forward to bringing Children's along in this journey and making sure we have the right technology, the right processes, the right data to help with our expansion and our goals. So thanks for inviting me. I'm glad to be here.
Yeah, great to have you, and looking forward to hearing about some of that work and how AI factors sort of and the workforce factors into this expansion. Thank you, Rick, so much. Seth, let's meet you.
Yeah, thanks, Brian. Good morning, everyone. Excited to be with you all today. My name is Seth Lovell. I'm the Assistant Vice President of Nursing Transformation and Innovation for SSM Health. We are a Catholic, not-for-profit, fully integrated healthcare system that primarily serves 4 states in the Midwest, about 40,000 team members, about 23 acute care facilities, clinics, et cetera. I've been with SSM now for about 5 years. I currently lead our domestic and international clinical pipeline development. In addition to that, I have accountability for workforce planning, optimization, operations, and modernization, which obviously I think will intersect with our topic today. I've been in healthcare for now over 16 years, and previously I was with Intermountain Health, located in the West.
Excellent. Appreciate you being here, Seth. Let's dive right in now. So obviously, hospital and health system leaders are no strangers to change. I think that's probably always been true. It feels exceptionally true at this moment. I'm thinking here about revamped roles, cuts, additions, realignments to drive new strategies. I guess just want to hear some takes on the experience on the ground, how these trends, these talent management trends, workforce trends, particularly with regards to leadership acquisition, how those have really manifested at your organization. What are you seeing? What are the challenges? What are the opportunities here? Seth, can we begin with you?
Yeah, you bet. Brent, thanks so much for the question. And I will tell you, I actually appreciate maybe the focus on the leadership acquisition portion of this. There's been a lot of focus on the general workforce challenges, especially in healthcare as it relates to clinical caregivers. But I think that we're seeing a lot of the same impacts that we saw through COVID, right? Maybe an existing underlying problem that was exacerbated that's now impacting leadership pipelines. Just noticing a trend and a concerning trend of kind of the lack of robust pipelines for middle tier leadership that want to grow and develop, that continue to lead critical work into the future. I think the opportunities that really come from that is for us to be really intentional with how we inspire leadership. I think all of us on this call would probably point to a few of those moments for us that inspired us to really dedicate ourselves to leadership for the rest of our career. And I think that we also need to do a better job of developing programs that will help equip those individuals with the necessary skills and knowledge to navigate just the challenges of leadership. I think on the flip side, some opportunities that come from that is there's an abundant opportunity for people that do want to grow their careers. And I think that we've seen maybe just recently more diversity for portfolios. I think there's a lot of atypical portfolios in leadership as those consolidations have happened, the cuts, revamped roles. So instead of being more of a specialist per se in leadership, we're seeing a lot more generalists as well.
Excellent. And quick follow-up for you there, Seth, I think in terms of really bringing those leaders along and I guess cultivating leaders internally. I've also heard the sort of the mid-level leaders and all that stuff. What does that work look like tactically on the ground? Can you give like a snapshot of what that entails?
Yeah, no, I think there's a variety of responses that come to mind, but the one I'll really circle in on the most is being intentional with mentorship. Leadership's hard, and if anyone says otherwise, I think that they probably haven't had a lot of time working through some of the challenges that come from that. And having a dedicated mentor or mentors where you can really start at the foundational level and maybe talk about the different types of leadership and being well versed so you can use different types of leaderships given different situations, all the way through basic operations, all the way through some advanced areas like strategy, et cetera. So I would really maybe go back to maybe some of the foundational principles, which is how are you actually sponsoring someone and helping them guide through some of those early learning curves and bumps and bruises, so to speak, that often come with leadership roles.
Sort of a back to basics, focusing on human relationships sort of element there, Seth. Thank you for that. Wendy, let's check in with you now. And what's your response to the question I
Sure,
posed in terms of the
absolutely.
challenges, opportunities here? Go ahead.
Like Seth mentioned, I think as I have seen it, a lot of baby boomers are exiting, right, the organizations, and that's kind of where the leadership was. So identifying opportunities to help with succession planning for people that want to go into leadership roles is extremely important. We've created what we like to call an emerging leader program that we have identified. Getting people ready for leadership roles, I think, is important as well. We've all experienced the burnout from COVID. I think some leaders are just ready to go. And how do we re-energize those leaders and then also look towards the future? One of the things too that I think we haven't mentioned is that diversity of leadership. So not only looking at and helping, but learning what's going to work best for a leader as well. As more women enter leadership roles, making sure that we have a good work-life balance, understanding the challenges and dynamics that people bring to the organization are important too. And I think when we go out and we look and we're searching for leaders, looking for that right fit, not only for them as an applicant, but also for the organization to see, is this the right fit? So it's become complex in the last few years.
And can you go into some details in terms of what the right fit is? And has that right fit have I guess the parameters on what the right fit is changed in recent years. I think we've heard we've done some reporting, some interviews and stuff like that at Becker's where there's sort of like, it sounds like there's been somewhat of a shift in leadership style in recent years. So any insight you have there, Wendy?
Well, gosh, working on my dissertation, and my entire dissertation is around women leadership and looking at opportunities for women leaders. I think when you look at that, it's looking for a good fit for everyone, but being a transformative leader as well. I think understanding, Seth mentioned the complexity, and I think it's really, do you have the right fit when it comes to what we consider as culture? I think it's important to look at the culture of the organization, understanding the mission, vision, and values, and how we carry that forward. And what does that look like? I think it changes. We recently went through a change where we were a public health system to a not-for-profit, and really had to assess and look at the leadership and the capabilities. And is this going to get us to where we need to be in the future? Sustainability is huge in healthcare.
Yeah, there's sort of you got to know yourself first before you can even know what the right fit is. So there's some internal searching that needs to happen, it sounds like.
Correct. Agreed.
Yeah, thank you. Thank you,
Sure.
Wendy. Garrett, let's hear from you on this question.
Yeah, I mean, I agree with the previous speakers on a lot of that. Just talking about that cultural integration, making sure they're that right fit for us, right? And working and being collaborative with the team is always a challenge. Talking about the mentoring and things like that to try to grow your own from within, because talent retention is always a challenge today. Everybody thinks it might be, the grass is greener on the other side, but maybe that's not always the case. But some of the opportunities I think that present itself in all of this is, when you bring somebody else in that you feel, fits culturally, and things like that, is you get some fresh perspectives, right? Somebody new to the organization that may have seen and done different things that maybe you haven't tried before or haven't seen before. And then again, just developing talent internally, identifying that succession planning, and trying to grow from within at all levels. And I think that it can provide some agility and adaptability within the organization as an opportunity, as things kind of shift, that you have the opportunity to take a look at, how can we be more nimble in those things that we do.
Yeah, it sounds like too there's some level of like trusting your hiring process, or trusting like that you brought somebody on and you let them have their new influence on the organization in some sort of way. Am I reading that correctly?
Yeah, when we bring somebody in, we don't want them to be a wallflower and not provide their perspective, right? And to be able to speak up and give input and say, we've tried this before in my old organization or what have you, and it was a complete failure, but here's what we learned from it, and maybe it can be successful here, or we tried this and it was very successful and you haven't looked at that before. So we want people to speak up, speak their mind, and listen to what they have to say. But of course, eventually it's a decision that leadership makes, and we move forward in alignment, at least.
Right. Thank you, Garrett. Rick, let's hear from you now.
Yeah, no, appreciate what the speaker said. I'll piggyback and take it in even another direction, right? So I equate this question back to something that we're starting with and on the forefront with, so we're getting better at it. But workforce planning, coming into healthcare, it's a good problem to have, and it's a good complexity to have, but it's nonetheless a complex problem. How we find all these leaders, right? And I equate leadership not just to the most senior level positions, but critical roles that we need to fill, right? So a good problem to have, but with our expansion, we are set for a new pediatric campus a few years from now, but even closer to home, up in Plano, Texas, in the far north part of Texas, in the Dallas area, we're going to be coming online with a brand new tower that requires a lot more positions to be filled, nurses, leadership positions, senior level positions, and there's a lot that has to come together for that, right? There is recruitment strategies, there is buy-in, there is expansion, there is facilities work. When it comes to people, it all comes down to how you plan for it, right? And what that supply and demand looks like. And so one of the things I'm very proud of, and several of us, folks on my team, folks across our HR business partner community, and obviously our business folks in the business, our nursing leaders, other executives, have really come together quite nicely. We're using a certain technology to help us plan for this as we look at how aggressive these roles are being filled, how we can slice and dice that information, how we provide that information back to our senior leadership team, and how, in this case, HR is really on the forefront of driving the recruiting strategies, finding this talent, working with the business. And so I've worked in several organizations in the past, like we all have. Everyone does some sort of workforce planning. I think we're doing it the right way. We're investing in the right technology. We're having the right conversations. And this is going to ultimately make us successful to really, again, solve a good but a complex problem in terms of finding the right people in different leadership positions and across all positions.
Thank you, Rick. A couple of reactions for me. One, you sound very busy. And two, I do. Yeah, a little bit. Got a little something going on.
Right.
And I appreciate you flagging the technology component. We are going to dig into that shortly, but Meredith, I want to make sure you have a chance to sort of react here in terms of what you've heard from these folks. Is it sort of align with what you generally hear among AMM's partners, what you're hearing out there? I want to give you a chance to react to that before we sort of dive in earnest to the technology component here.
Great. Thanks, Brian. Everything every one of the panelists said certainly resonates, and we're hearing this from across the country from a number of clients, number of different health systems, rural, urban, large, small, for-profit, not-for-profit. Workforce is a key focus, and getting the right people will always be a priority that helps enable strategy. I love where Rick went on really stepping back and saying, first we need to plan, in order to get where we want to be, what do we really need? Not just from a numbers perspective, but from a leadership persona, from a type of clinician, from skill sets we want to be building on. If we really are trying to integrate and think more technologically, what do we want to be instilling in our entry-level employees to have a talent pipeline? What kinds of behaviors do we want to encourage along that talent journey? How do we inspire people early to want to move into roles that are going to help us get to our ultimate end goal? So those are all certainly things we hear a lot and personally excite me a ton. I think a lot of folks are doing some really great initiatives across the country to get there, and I think technology is going to be something that hopefully helps all of us.
And let's get in there on the technology piece, Meredith, because I know it's something you're passionate about and work a lot with. Thinking, of course, AI certainly comes to mind. I think the stat I have in front of me, 60% of healthcare, they're actively dedicating resources to invest in AI-based tools. So I guess I want to just hear in terms of how AMN thinks about this, how other organizations, the health systems represented on this call, really embracing tech or innovation in terms of thinking about talent acquisition functions. Meredith, I'll give the floor to you to start here, and then we'll get some more thoughts from folks.
Great. I love the capabilities that AI has already posed and continues to do so. I think I'll break it in almost in three areas. The first one is just AI and predictive capabilities to look at what we need, what we think we need, how we can really optimize when we're trying to either project the number of folks or when we're scheduling people to try to optimize there. The second area is talent matching. We have such cool capabilities now with AI. I know at AMN, we use AI in our matching algorithms for leaders, for physicians, for nurses, for allied professionals, when we're trying to match folks to either permanent roles, temporary travel roles, or even single shift. In addition to both looking at some of the logistic factors, we were able to look at dozens, if not hundreds of areas and say, hey, you might love this opportunity, or have you ever considered a pathway toward this kind of a role ultimately? Because you have all of the ingredients to be an incredible leader. In our leadership search team, we have these conversations often, and we use AI to even help go through and say, what could you do? What would you be great at? And open people's eyes. And I think it's a really cool opportunity and even an opportunity to improve diversity in our workforce and our leadership ranks by getting people inspired earlier in things that might not be obviously, immediately apparent. And then that third area is just the AI capabilities around efficiency in the recruiting process. Folks do not want to wait. We live in a culture where you can have anything on your front porch in an Amazon box same day or next day. Folks don't want to wait. When you engage with a recruiter, when you submit an interest in something, I think we can be a lot, and we are personally investing quite a bit on just being smarter about immediate responses, quick, hey, on your application, this was missing. Can you fill this in quickly? That happens real time versus having these cycles that, candidates either lose interest or it just becomes really burdensome to fill roles.
And that applicant experience, I imagine, is so important, right? In terms of what we all experience in the regular world, and then they come to an organization and they have this sort of clunky experience. It's probably not the most confidence-inducing, I guess, is how I would describe it. Is that correct?
Exactly. And it lets you, leverage the recruiter or the personal part of it in a really effective way that can have that fabulous experience component.
Yeah, thank you, Meredith. Rick, you sort of flagged the technology component for us in this portion of the conversation, so I want to make sure you get some space here to share what you're doing.
No, thank you. I love this area, and I love what Meredith said and how she said it. So just piggybacking off what she said, at Children's, specifically for some of our efforts that I'm responsible for, we have been very actively evaluating several AI-based tools for a few different reasons. One of which is, as I mentioned before, to really support just the great growth efforts that we have across our locations, potentially a new pediatric hospital that I mentioned. These AI tools that we are looking at and targeting will be critical to help us support, particularly from a talent acquisition perspective, the aggressive recruiting targets and expansion targets that we have. I like to think, AI is a lot of different things, and it's continuing to evolve. I like to think very close to home that AI solutions from a talent acquisition perspective are a recruiter's and a sourcer's best friend. In a matter of seconds, these engines, and I've seen them work, can generate, a list of qualified active candidates, passive candidates, very well, rate and rank against jobs, against skills in a much more efficient way than, kind of traditional sourcing practices do today. And it's just a huge time saver for a recruiting team in any shape, but especially those that are in active expansion mode. Meredith was also mentioning the talent management side, something that we're looking at as well. Some of these AI engines are very critical to help us identify critical skills for roles and all of that mobility and talent management practice. So I think, long story short, we are seeing, and I've seen AI be very effective in the very beginning of a funnel, and maybe not the end, but towards the middle of the funnel in terms of recruiting, hiring, planning, and then managing that talent for open roles, right? And so I'm very bullish about what these technologies can provide any level of organization, but especially those that are growing a lot like we are.
It's interesting. Like I've heard quite a bit about sort of in the past leveraging this technology to get folks in the door, but Rick, how you're talking about it, sort of managing them throughout, and goes back to that sort of the leadership component of the conversation too, right?
Absolutely, and it was what Meredith was saying. Like what especially in healthcare, there are so many unique and different roles. People are gaining these skills. We want to set them up for success, right? And maybe they're a pro in position for 20 years, or maybe they're going to bounce around in some different areas within the hospital or within different clinics. Let technology help with that, right? And that's where some of the skills-based matching comes in. And that's where I think it's very exciting that, depending on your organization, how much you want to open that up and how much internal mobility and movement that you do. These are tools that really help with that on the administrative side, but also on the employee side. So they can blow out and say, here's what I've done, here's the skills that I have, here's, how I'm matching to different jobs. And in certain tools that we're looking at, how it really provides very, very concrete career pathing and options, how you go from point A to point B and all those different things in between, whether it's mentorship opportunities or conferences that you need to attend, or whatever that particular career path is. And so, like I said, I'm a tech geek at heart, and really, because it really does, it's starting to make a difference. Again, not just efficiency wise, but from an employee experience perspective, and providing that level of visibility to a lot of our employees to say, here's how I can manage my career better, and here's what the art of the possible is.
Yeah, and I would be remiss not to note that Becker's does do some conferences. So if you could work that into sort of that algorithm you have there and flag those for folks, would be much appreciated.
Already done. Absolutely.
Thank you. Thank you, Rick. Seth, we haven't heard from you in a bit, so I want to check in here. How's SSM Health really leveraging AI here to enhance workforce strategies? Anything you're working on in this space you really want to share with attendees today?
Yeah, Brent. Well, actually, I share Rick's bullish mentality on this. And I think I'll build off a few points that Meredith really, I think, did a great job articulating. Before I do that, I kind of want to go back just a little bit and really promote how important it is to have a really defined process. Far too often, I made this mistake throughout my career where we have an unoptimized process. We believe that technology is the solve all. We bring it in, we implement it, and it doesn't get the results that it was intended to do. So I'll continue to promote, focus on process first, then evaluate technology and the human capital to support that, optimize that, and then focus on automation. So I think there's a lot of pre-work that needs to be done before we start saying that artificial intelligence is really going to come in here and supplement the way that we want to. I maybe will go in a little bit of a different direction and highlight some of the work that SSM Health has done related to our talent experience management space, specifically adopting a new technology that we felt like was an enabler for us, a critical enabler for us to really help us transform ourselves and do some self-disruption in the talent space. So we recently changed that about a year ago, and we've been really impressed with the enhancements that we've seen so far. I'll mention a few just as a highlight. It's almost out of the box optimized for SEO, at least when we compare, to our previous solution. We've had a lot of focus on leveraging technology to have quick apply forms where, before maybe you had 10 required fields. That's now been pared down to 3 or 4 to make it easier for candidates. And I'm really impressed too with how we're able to host apply forms in social media platforms. So again, we used to drive people to our job board. And now we're saying, just engage with us where you're at. You're spending, hours per day on social media. If you're interested, drop a couple of fields here, and we'll get back to you, really quickly, focusing on the responsiveness piece there. This also allows us, I think, to have much better capability, especially multimedia capability in job posting content, being able to maybe see a tour of the hospital they're applying to, or have a chance to understand a little bit more about the system instead of just reading through an outdated job description, I think is the way of the future. And then also having a really good understanding of the digital journey of our candidates, and then even having granular visibility into the service level expectations that we have for those that are, kind of maintaining the talent process. So right now, we're focusing on responsiveness far more than we ever have. And I think Meredith really highlighted that. And I think that aligns with, what the workforce wants. And maybe last would say getting quite a bit of benefit from CRM campaigns. And I would say those are not new, but when you think about some of the minor changes recently, they look and feel a lot more organic and conversational instead of kind of spammy, where you're able to say, click 1 to unsubscribe and stop to stop messages. So I think those are some of the more recent examples that SSM Health has implemented that we have been, again, impressed with the impact.
Can you say a little bit, Wendy, I want to come to you next here, just so you know. But Seth, can you say a little bit more about a transition in some of those CRM campaigns and how they've gotten to this place where they feel less spammy? It just stands out to me in working in an environment where I feel like there's probably a trend towards like a lot of spammy stuff happening right now, and people trying to figure out how to navigate that, how to make stuff stand out, how to protect their folks from that stuff. So, Seth, can you just share a little bit more details there about that transition?
Yeah, some of this may seem basic, and I'm sure others are doing this a lot better across the country. But just to connect a few dots, we would have a number of individuals that would decline offers due to the pay, for example. And let's say that we enhance the pay scale of that job profile in a specific market. It used to take quite a bit of manual work for our teams to re-engage and have a re-engagement campaign through some limited technology that we had before. Right now, we have that detail within our CRM, our experience management software. And with one click, right, we can actually re-engage those individuals that told us no previously because of pay and compensation. And instead of, again, going into a queue where 48 hours or even longer, talent acquisition individual would reach out, they actually might be able to engage live with someone and do it texting, right? I know we all have busy schedules. I wouldn't be able to jump on a call, without a moment's notice often, but I can respond to text, and I do actually communicate primarily through that. I think with a lot of the workforce, and so being able to actually converse in a venue that is very natural, that is actually again assigned to a dedicated person instead of going to a generic queue to get maybe a call back, within a couple of business days.
Yeah, text definitely speaks to me. And speaking of spam, I think 70% of my phone calls that I get now are probably spam. So there is that experience too. Wendy, what are you doing in this space? How are you leveraging AI at Erlanger?
Oh, goodness. Well, I think Meredith mentioned predictive analytics, predictive modeling. That's been around for a while. And how do we utilize that and look at that? One of the things that I think that we're doing that's important is when we're looking at sourcing candidates, using a tool, an AI tool, certainly eliminates some of the biases around that. And I think that's important when you're sourcing, and it's quick and it gets you candidates rather quickly. Seth mentioned going back to candidates that had previously applied or had engaged online, having that open ability to communicate with them, continuing communication, I think is important. One of the things that we haven't discussed, and to me, it's about talent acquisition. Once you got them, what do you do? And so I think leveraging AI and predictive modeling, looking at opportunities, I think Rick mentioned it, within the organization for upward mobility. How can we use the talent acquisition software to continue those conversations is important too, and tying it back into performance management, not just one time a year, but really looking at what we're doing throughout the year and using that predictive modeling to ensure that we can continue those conversations. One of the things too that we've created here at Erlanger, we're in the process of, is building out a call center for HR and using a lot of AI around that so employees can have real-time data rather quickly. And so we're building out those bots right now. But I think overall, it enhances our ability to be strategic partners within the human resources space.
Excellent. Thank you so much, Wendy. I appreciate those additional comments there. Garrett, I want to make sure to give you some space to talk about what you're doing it here before I move to another question.
Oh, thank you. Yeah, we're actively exploring some things, and it's very similar to what everybody has mentioned here. But just trying to make that candidate experience better, right? Be more responsive, provide information that they may be looking for. And then you mentioned was the predictive analytics. Something that I guess hasn't been mentioned, at least I don't believe so, is using AI for like an interview analysis, right? If you did a remote interview like this where you recorded it and things, you potentially use AI to analyze that interview for the potential of the candidate. Of course, there's potential pitfalls around bias and different things like that, but it's an interesting area that could be up and coming more. And then just giving better onboarding support. Again, providing information to questions that candidates may have as they're moving through that process at a quicker pace than, as we've heard, maybe it gets delayed a day or two or more, but being able to provide those answers, whether it's through virtual assistants or chatbots, things like that, the standard things that we may hear, and not have to go to a person for that. So those are some of the things we're looking at.
Yeah, thank you, Garrett. And I think one of your comments there brings me to where I wanted to go next, which is clearly there's exciting capacities here with this technology. But I wouldn't be doing my job if I didn't suggest there are some barriers or potential challenges, things to navigate. It's not necessarily everything isn't perfect all the time. So I want to get some talk about sort of what some of those barriers might be to applying AI in these spaces. What challenges have you potentially encountered? How do you think about overcoming those challenges? Garrett, you sort of, I think pitfalls is the word you use when you describe this, potentially like using these for analysis. So I'll give you first crack at this. What barriers do you see here, and how do you think about overcoming those?
Sure. Again, just the biases when you start using, candidate sourcing or identification and screening. There may be areas that AI just doesn't understand the context that you're looking for these candidates. So I think you're still going to have a human, right, kind of review some of these things, and just I think it was mentioned before, again, Wendy may have mentioned, diversity and inclusion. Is there a bias built in somewhere along the way, and making sure that you're looking at diverse candidates and being inclusive of all, and trying to, again, that context of everybody's experiences are slightly different, but does it, can it understand that really this is a good match for the organization based on what it's seeing? So I think those are some of the areas that will be challenging.
Yeah, and I imagine too, it aligns with a lot of the work folks are doing in terms of understanding potential internal biases that have already been in existence and making sure those somehow don't get sort of codified into the tools along the way. Wendy, I want to give you some space here to talk about any barriers you see and how you think about overcoming those, and then Meredith will come back to you.
Sure. Well, I think one thing that we need to focus on is human resources. And so you can't just take out humans and interact with AI. So I do think, that's important to find that balance of using AI and still having human interaction as well with candidates. Making sure the employee experience, the candidate experience, whether it's patient experience, that everyone feels that connection. And you can't miss out on that. So I would say that would probably be one of the barriers. And we want to make sure that we've got that unique balance between the two. And then the bias, it could be if you don't build it correctly. So looking at how we build it as well.
Being on the lookout for those biases, and not just like prioritizing the efficiency and convenience that can come along with these tools, but that human touch, that personalization touch, right, Wendy?
Correct.
Yeah. Meredith, what would you say here?
Garrett and Wendy hit, my biggest concern, which is just bias, which can be built in. I think, Seth, when you earlier said if you have a bad process and you add AI and you automate, you just have faster bad process, basically. So I think those are sort of the two buckets where I go. Garrett, you were mentioning virtual interview. I think one example here of where you can, use AI and technology in a good way, but also realize that personal connection needs to happen. We leverage virtual interview in a lot of our recruiting processes, at least as one of the steps, mostly to allow someone to very quickly answer some questions. We'll use technology to understand, is there a good match here? Does this person have both the skills and the experiences we're looking for? But very quickly in that candidate's journey, we ensure they're being followed up with by a human and a person, and ideally someone who can also tell them especially if they're a good match. Hey, let me tell you about, why I love working here and why this place is great and why you should love it too, because that personal touch piece makes it not feel like you're, in a robotic process with AI. So, I think the bias part, we're all going to need to come together to help overcome, especially as generative AI and other areas infiltrate broader parts of healthcare. And how do we really make sure we're thinking about all of the potential outcomes and having human intervention at the right spots? But I think the ultimate power of AI is and has outweighs some of the risk, as long as we're thoughtful and we don't go too fast in areas that have real potential catastrophe.
Bias is something that just you're not going to be able to take your eyes off that ball, so to speak, as this continues to roll out. It's just something that it's going to be essentially like good AI hygiene. I guess is how I would think about it. Thank you, Meredith. Rick, would anyone give you some space here to add on? I know much has been said, but give you space, and then Seth will hear from you.
The panel did a really good job there. I think a couple things. I think companies, specifically need to think about the perception of AI, right? And in my world, in my jobs, even teams that I've led, is my job being replaced? Is my job being replaced? In most cases, no, it's not. It's a partner, right? AI is a partner to make your job easier. So I first and foremost think about how we talk about it, right? What it is and what it isn't. New things can be scary for people. So just putting my change adoption and change management hat on and leadership hat on, it's very important to talk about what AI is and what it isn't, especially today. But just reiterating what the rest of the panel said, I believe it's a partner and not at this point meant to replace the most critical of activities, which I would, and Garrett touched on this, making a final hiring decision. I'm sure you might be able to set a bot up or an AI engine up to maybe kind of, put that sort of analysis together, but that's not what it's there to do, right? We still need human interaction. We still need humans to make kind of those final decisions. So I go back to it can be a best friend, it can be a partner, but it's not an end-all solution. And how we talk about it, I think, is going to be very important, right? The other thing that I'll say, and a little bit kind of aligned, but not aligned, but a lot of organizations are spending a lot of time and effort and conferences about AI. That's really important. There's other things that are kind of AI related, but on the cusp too, and that's simply process automation, right? And there's different ways that processes can be automated through bots and through different engines and solutions. Honestly, when I look back at my career and things that I've tried to develop and push forward in organizations I've worked at, we've seen a lot of great capacity building when it comes to simply automating a process. As Garrett was mentioning, the use of bots, whether they be chat bots or process bots, to say, hey, the best one I can think of is an employee referral process. It's a long process, 30, 60, 90 days. Recruiters have to remember things. Payroll's got to remember things. Multiple systems involved. You can automate those things just like that, right? And so you take the manual work out, you take the guesswork out, you build capacity. So AI does that, but even I like to call them more simple things, process automation, bots that are very relatively easy to get up and running, as long as you have the right inputs. I like to have companies think about that. So all of that space, I think, is very important for organizations to be effective these days.
Very much appreciate that sort of additional hook on about the stuff that kind of sits outside, some at the periphery of the conversation of AI, right? Flagging that for folks. Thank you, Rick. Seth, any additional hook-ons from you before I move to a final question for the group?
Yeah, maybe a couple quick thoughts. I think Rick really got that right. The narrative around AI and have it replacing the workforce has been in abundance out in the communities. I think we're obviously quite premature from that perspective, but this is really representing a rapid pace of change in an area that we haven't really seen that pace before. And so I think just an organization's ability to do change management, or maybe rather change leadership, is going to be really critical. I'm also concerned about having the right level of trust and mistrust. And I think that really ties back into a couple of points that Rick and Meredith had talked about. We have to understand where the pitfalls are and make sure that there's a human there to kind of help navigate that. And I would say maybe last, I'm still just concerned about an unintentional increase in workload burden for those that are delivering care. Because I know that we're going to continue to evaluate new solutions, do some new pilots. We may implement those, and oftentimes we have good intentions, but when it gets right down to implementation or the operations of that, it does increase workload burden for our workforce that is already overburdened from everything we're hearing from them.
Yeah, and the other way I've heard some of that sort of talked about too is if a solution is rolled out where you actually improve efficiency, making sure that efficiency, staff are allowed to feel that efficiency versus giving them sort of something else to do. Necessarily. I appreciate the conversation today. It's been really enlightening for me. I've learned a lot from you all. There's certainly a lot we didn't get to, many different avenues, roads this conversation could have taken. So I want to close out here by giving each of you 30 to 60 seconds to really just share some final thoughts. Maybe it's something you weren't able to get to. Maybe it's something you want to reemphasize, a piece of advice. I leave it to you how you want to close out here. But Garrett, we'll give you first crack at this.
Oh, thank you. So I guess, final thoughts is it's exciting on what the technology could do, but in some sense it's also scary of what the technology could do. With the biases and things like that, right now there may not be good high quality data for the models to really utilize it to the extent that it can be. And just, understanding that, as was mentioned, right, is it's not going to replace the human element. You're still going to have other people make that final decision. It's a tool, right? And something that can make the process more efficient, hopefully can identify quality candidates quicker, and make that experience for the candidates much better. But in the end, we still have to have people make that final decision based off of what the tools provide us. But it's exciting, and I can't wait to see where it takes us.
Yeah, certainly exciting times. Wendy, go ahead.
Sure, I agree. It is exciting. I think there's so much opportunity within the healthcare space for AI, from the patients, navigating patient care, to the delivery of what we do in human resources. But I think we have to be good stewards. We have to think of how we utilize that and appropriately, kind of like when the internet came out. What did we do? And so I think, there needs to be a look at how we actually utilize it for the betterment of healthcare.
Thank you so much, Wendy. Rick, go ahead.
First of all, thank you for having me. Part of my job is to look forward into the future and also understand what progressive organizations are doing so we can be better equipped to meet those challenges. One of the things that I've seen and learned, and some organizations are doing this and we're looking at this too, is the possibility and the potential of employee skills, right? And that's why I love what Meredith was talking about. Whether there's technology that supports it, but in general, we always, and we should never throw away someone's resume. We should never not consider their experience. But I think it's very important for organizations to think even more holistically about skills and potential. And some organizations, very progressive organizations, are doing that, right? And again, this is where good technology can come in to help support. But philosophically, that's one thing I'm very excited about. I know personally there's lots of things that I may not have on my resume, but I've done. And I would love to, venture out and do. And so I think employee experience, I think planning, I think, how we move people into different positions, more efficiently. The focus on employee skills might be something that more organizations start to think about as an adjunct to experience, standard resume, and those sorts of things. So I'm excited for what the future could potentially bring in this space.
I appreciate that, Rick, and appreciate you being here today. Seth, go ahead.
Yeah, maybe I'll just echo Rick's comment. In fact, he almost took the words right out of my mouth. I think I'm really looking forward to this technology forcing us to shift from pedigree or minimum institutional qualifications to, talent. I think Rick mentioned skills or even just talent potential. That's going to be really exciting. And I think when you kind of forecast what this looks like for recruitment in the future, Even though I don't know if I've seen strong examples of this widespread today, I do believe there will be a near future where prospective employees are actually evaluating the technology and the impact it has on the work environment as a primary employee value proposition point. Where right now, I think primarily that's salary and benefits and maybe culture of the organization up front. So obviously, getting this right is going to be critical to those that really want to succeed in the talent space long term. Not doing it too progressive, I think, as Wendy had mentioned, before, but finding the right balance and actually getting down to the point where we're actually adding value is going to be key.
Seth, thank you so much. And Meredith, you get the pleasure of sort of taking things home here.
Oh, following all of that is hard. I couldn't agree more with what
I
everyone
know.
said.
You're welcome. You're so welcome that I set you up that.
Pleasure to be on the panel with all of you today. For me, just in closing, people will always be at the heart of recruiting and talent development and, healthcare, really. So as we think about technology and AI and other components of technology, making them work for us, making them work for those people, making it better is the real goal. So integrating the process, first designing the right process to Seth's point, then integrating the process and really using AI to unlock things that otherwise we just couldn't do as humans. So I just am very excited about the potential for it to bring out the best in every single person along their entire journey, not just at a single pivotal point of applying for a job, but as they go forward and their situation changes or they get excited about learning about something new. How can AI be a constant stream that's probing in a positive way and helping make the connections and telling their leaders, hey, look at this, and giving opportunities. So very excited about what we already have done and about the potential leading into the future.
Thank you, Meredith. I think you did a nice job of putting a bow on things. Truly appreciate it. Thank you, Seth. Thank you, Rick. Thank you, Garrett. Thank you, Wendy, for participating today. It really was a pleasure. Thank you, attendees, for being a part of this as well. And thank you, AMN Healthcare, for helping us put this together and sponsoring today's webinar. To learn more about the conversation we had today, you can check out the resources section on your webinar console and fill out the post-webinar survey. Thank you so much for taking the time and joining us today. We hope you have a wonderful rest of your day.